Hi, I'm Richard Carter, and welcome to This is Surgery, where we get to look behind the scenes of healthcare and talk to people shaping what surgery looks like. I'm joined today by Charlie Robbins, our VP of Sales Americas, and together we're speaking with Dr. Aziz Aadam, Director of Interventional Endoscopy at Northwestern Memorial Hospital in Chicago. Dr. Adam directs both the clinical program and the fellowship at Northwestern. He trains the next generation of interventional endoscopists while leading the institution's global health partnerships. So today we're talking about what it takes to run a high-performance endoscopy program, how technology is changing the specialty from the inside, pun intended, and what the intelligent room looks like next. Dr. Adam, it's a pleasure to be with you today. So how would you introduce yourself? In your own words, who is Dr. Adam?
Well, thank you for having me. My name is Aziz Aadam. I am an interventional endoscopist at Northwestern Medicine, where I serve as the Director of Interventional Endoscopy and the Medical Director of Global Services. I perform a high volume of third space endoscopy procedures in addition to EUS, ERCP, and other advanced procedures. I'm passionate about endoscopy, of course. I love technology and how it can enhance the work that we do every day.
And endoscopy, I think, is possibly a new thing for us on This is Surgery. And I can imagine a lot of people just sort of lump it in with surgery. Is there anything that people sort of might commonly get wrong or be surprised about when thinking about endoscopy?
Yeah, I think, interventional endoscopy or endoscopy in general, it's perceived as just being, a diagnostic procedure or even just placing stents, not really understanding the cognitive aspect of the work that we do. Interventional endoscopy specifically, it's really a collaborative specialty. We get to work with surgeons, interventional radiologists, and other specialists really to be able to solve complex medical problems.
As part of your training, you went to Japan in 2015, specifically learn endoscopic submucosal dissection or ESD. What took you there, and what did the trip change about the work that you do every day?
It's curiosity, really. We started to hear about this procedure called ESD, endoscopic submucosal dissection. The more I started to learn about it, I was fascinated. I was enjoying performing EMR, mucosal resection, but ESD really did seem like the future. It was just something I had to explore. So when I went to Japan to the National Cancer Center Hospital in Tokyo, it was truly an eye-opening experience. The level of endoscopy, the technology that they had at the time is just steps above what we had available to us. And the technical expertise is really mind-blowing. I was incredibly fortunate to learn from the Japanese and be able to incorporate what I learned into my own journey as an interventionalist.
So there'll be quite a few non-clinicians watching this episode. Could you just give us a sort of brief introduction into what ESD is?
Yeah, of course. So when we think about, when you remove polyps, they're at the mucosal level. And even more type of advanced polyps, they're mucosal. They can get even into the next layer, the submucosa. And this submucosal dissection allows you essentially to get underneath that layer to remove what we call end block. So you're removing the entire polyp and a little bit of normal tissue to ensure that we have negative margins. And if this is an early cancer, as an example, this allows us to be able to remove and even cure that cancer.
How common is this kind of procedure, in 2026?
So it's increasing, quite a bit in North America and in the West in general, in the Eastern countries and Japan and surrounding countries. It's been increasing, ever since around 2000. But I'd say in the United States specifically, when I went in 2015, there was perhaps a handful at most in the United States performing ESD. And now it's much more so. Most academic centers are performing ESD, and now it's even in the community centers as well.
Quite a rate of progress. So turning to the to your fellowship at Northwestern, which you now direct, what is it that you're looking to achieve, and what are you, I guess, hoping to build people to be able to accomplish as they come through the fellowship?
We're really trying to develop the next generation of leaders in our field. We immerse our fellows in the newest technology, the latest procedures, Just as an example, a few years ago, endoscopic ultrasound, one of the procedures that we do, it was more of a diagnostic modality. It's now really an incredibly therapeutic procedure. We now have the ability to perform endoscopic gastrojejunostomy, something that has always been surgical. And now patients don't have to wait 6 weeks after their surgery to initiate chemotherapy. We can perform radiofrequency ablation of tumors, bile duct, gallbladder drainage, really in a minimally invasive manner. And we teach these to our fellows so that when they complete our fellowship, they're able to introduce this into their practice.
How's the fellows that are coming through the program changed since you went through fellowship from a, adoption of technology or willingness to kind of adopt new and cutting edge things versus maybe when you or some of your mentors went through?
That's a great question. I think it was very standardized. There was endoscopic ultrasound, mostly diagnostic. We were doing needle biopsies, ERCP, some luminal work, but now it's really evolved into, kind of niche areas. So you could choose your own pathway. You know, Someone might just enjoy bread and butter, standard pancreatical biliary endoscopy. They may really want to get into this third space area as kind of a niche where they're doing the ESDs and poems. And now there's endoscopic metabolic procedures, obesity procedures, where they're doing these sleeve gastroplasties, they're doing these outlet reductions. There's just so many different avenues people can really take their career in.
And I mean that's a very fast changing technology landscape, and hopefully Proximie's been a part of that as well. I know that, for example, in 2024, I think you ended up doing 5 simultaneous live endoscopies across 2 institutions. Can you? I mean, that must be quite a ride. Can you tell us a little bit about that?
Well, it's like my gladiator moment, right? You're like, single column there, single column there. Uh, but Proximie, it's really an incredible platform. It's the ability to connect multiple procedure rooms in a single interface. It's just really seamless, and that is what's remarkable. And being able to stream a procedure without any lag time, no buffering. So this allows that viewer to immerse themselves as if they're right there in the procedure room with you. It's really about that real time connectivity. It's allowing for enhanced decision making and problem solving.
Wow, thank you. When you've expanded to London, I think, and are looking more globally, have you got kind of global connectivity in mind there as well?
Absolutely. We're always looking to expand our global network, and our collaboration with London Clinic allows us to do exactly that. Proximie's been integral in that work. So we've opened up a motility center in London. This allows patients in the UK to undergo motility testing using the same protocols that we've developed here at Northwestern. I recently had a very complex case. I wasn't really sure how to approach this for a patient who had actually traveled 8,000 miles to see me. So
Wow.
I asked my good friend at the London Clinic, Vinay Segal, to join me virtually. So it was like 2 p.m. the afternoon here in Chicago. It was 8 p.m. in London. He was just getting home off the tube. Um, so I sent him a link via Proximie. He clicked on it on his phone, and instantly he was able to view my live endoscopy feed directly from my processor in our room and assist me in real time. We had two-way audio communication, and it was pretty awesome. We were able to come up with a great solution that really should enable this patient to have improved quality of their life.
Oh, that's quite something. I imagine it would give passers-by a shock if they glanced at what was on his phone at the time. But
Yeah,
there we go.
exactly. Putting his kids to sleep,
Yeah,
and
that's how
what are you doing, Dad?
Daddy's still at work. Just
Yeah.
don't look at the phone. Don't look at the screen.
Doc, this leads into my next question, which is, that was a great example of you have these global ambitions and partnering all over the globe. You've got your own practice. You're running a really complex and busy fellowship, not only at one site but multiple sites within Chicago and your healthcare system. Could you define like how you look at efficiency, certainly within your program, but also kind of how you run your department at large, and what does efficiency kind of look like and mean to you?
Yeah, it's true. Training takes time. It can certainly impact efficiency. But if you think about all the different elements in patient flow, you're checking them in, you're getting them into the procedure room, you're sedating the patients. There's so many steps before the procedure even starts. So how can we remove the inefficiencies related to that process. And that's where technology and innovation can really enhance these processes. Then we have the time we can spend on the training. We can perform procedures to the highest quality standards and achieve excellent outcomes.
That's really interesting because just to pick up on that, it sounds like a lot of that efficiency is kind of around the procedure rather than within it. Is that fair?
Oh, that's absolutely correct. I mean, if you think about how long the actual procedure takes relative to that patient journey from the time that they check in, if you think about it, even for a patient to get to the hospital, right? And to have their instructions and where are they going to park and where are we located, and for them to be able to access that information, and if they have any questions related to it, are they going to have to call and be on hold, or is there a mechanism for them to interface with my clinical team without, breaking down some of those barriers? And that's where, a single point of contact, a integrated electronic medical record, with different vendors that we have, right? How is that going to make that patient experience better and everyone's job just more efficient?
So if you fast forward 5 years, what are the sort of major innovations either around the procedure or within the procedure that you're hoping to see?
Yeah, I think that future intelligent endoscopy suite, it's a very exciting concept. It's really will be about efficiency and making the work that we do easier. From enhanced patient flow, what we just talked about, to AI assisted procedure report generation, procedure recording. That's commonplace now. But what about being able to retrieve that video and not take an hour to download a 1 or 2 gigabyte file? I would love to see intelligent video editing, so maybe some AI assistance there. And then just taking it to the overall kind of landscape, seamless supply chain management, and just the overall ecosystem in that intelligent suite to reduce these pain points. Um, so I think we need, the most advanced technology to be able to achieve this. We'll have to integrate all of these different platforms. If you think about, all the different equipment that we have in our endoscopy suite, how do you integrate these all? How do you integrate these all? Image capture, video capture. This becomes a strong partnership between companies that supply these platforms to physicians, nurses, hospital administrators, and staff, allowing us to work together.
That's a great response, and it really kind of speaks to the team aspect of healthcare and where we're all trying to go. Last question, and we ask everyone this. It's one of my favorite questions. Beyond just the technical, performing of surgery, what does surgery mean to you?
Accepting you're an endoscopist.
Yeah, yeah. So surgery, or in my case, interventional endoscopy,
Yeah.
it's a therapeutic. It's a therapeutic procedure. It allows us to solve some, oftentimes very complex problems. And many times it doesn't even feel like work when you enjoy it so much, and it's that satisfaction that you get when you've really been able to make a significant impact in a patient's life after a challenging case. It's truly second to none.
Great.
Amazing.
Thank you very much.
That was our conversation with Dr. Aziz Aadam. What stays with me from this one is how much complexity sits behind what looks, from the outside, like a minimally invasive procedure, and how much the right technology changes what a team can see, do, and teach. Thanks so much for listening to This is Surgery. If you enjoyed it, please subscribe, share it with a colleague or friend, and we'll be back in touch soon with another conversation from the people on the ground shaping the future of surgery.